Hello, everyone. Welcome to Lunch and Learn with Indiana Ship. I'm Susan, and I'm joined by my co-hostess, Megan Rogers. And
Morning.
good morning or good afternoon, depending on where you live. Today's topic is nursing home coverage and how does Medicare cover that and what the limits are for skilled nursing home care. And Megan has put together a terrific presentation to educate us all. And if you have questions, whether you're watching us live on June 18th at noon Eastern Time, or you're watching this as a recorded session, go ahead and still chat in your questions. Megan and I monitor this, and we will respond whether you're live or whether it's later. So, Megan, thank you so much for putting this together. There's so many questions around what does Medicare cover? And people get it confused with Medicaid about covering nursing home
Yep.
care. So thank you for putting this together and helping us understand how it all works.
Oh, no problem. This is one of my other topics I like to talk about with Medicare. So let's get set up here and we will start. All right. So first thing, very important thing to keep in mind, Medicare does not cover long-term care in the nursing home. It just doesn't. It's short-term care only. So we're going to talk about those limits, qualifications, length of stay, what is short-term, how many days, and then we're going to just touch on at the end some potential options on getting long-term care covered as far as paying the bill, because nursing home care can be very, very expensive. All right, so what does original Medicare cover when it comes to nursing home? So our Part A, part of Medicare, we commonly call that our hospital insurance, but sometimes we also call it inpatient insurance because you have to be inpatient somewhere. So that covers you if you're inpatient at the hospital, inpatient in hospice care, or inpatient at a skilled nursing facility. And that nursing facility also has to be in network with Medicare. And it also has to be in network when you're with an Advantage plan. And we'll talk a little bit more about that shortly. So you do have to have Part A, and you have to have days left in your benefit period. Well, what is a benefit period? Well, one confusing piece of Medicare. So this is the only part of Medicare that has benefit periods. Basically, it determines what you pay out of pocket and how many days you have to cover you either at the hospital or the nursing home. So if you go into the hospital, let's say it's your first benefit period, okay? You go in the hospital, you start your days at 0. So you'll have a deductible to pay, but no copay. And then you go to the nursing home and you start on day 0 and your days start chipping away. Then you go to your home, okay? You're back in the community. If you stay in the community 60 days or longer before you go back to the hospital, and generally your nursing home coverage is going to start with a hospital stay, and I will answer why in just a minute. So you're back in the hospital, it's a new benefit period, your days start at 0 again. But let's say you stay in the hospital 20 days, you go to the nursing home, you stay in the nursing home 20 days, you go back to home. But then you're only home for a week, okay? Go back to the hospital. Susan, since you're in the benefit period, the same benefit period, do you start in the eyes of your insurance back at day 1 when you're at the hospital? Is
Well,
that
you
day
have to
1 or
be,
day 21?
right, you have to be out of your Part A services, whether that's in the hospital or in a
Mhm.
nursing home. And then you have to have that time period go by before a new benefit period starts. So it's all about the timing
Mhm.
and where and what type of services you are receiving.
Mhm. So you are not at day 1 again, you're day 21 because you were there previously in the hospital for 20 days. You went home, you were not out of your inpatient care for 60 days or longer. So I know that's a little bit confusing, but basically, just like Susan said, you have to be out in the community a certain period of time for your days to reset. So basically, that is surrounding what you're going to pay out of pocket, your copays, your deductibles, and how many days you have left in that benefit period. Susan, anything to add to that? I know I got a little confusing there.
Well, can you talk about what happens after day 100?
We're going to get there in just a few slides
Terrific.
or bullet points. It's down at the bottom here. But yeah, I'm getting there. All right. So, to even get to the nursing home, you have to be in the hospital and you have to be in the hospital inpatient. You can't just visit the hospital for an ER visit or observation or outpatient status. You have to be there inpatient, and your doctor makes you inpatient or outpatient. They have guidelines that they have to follow. And you have to be there at least 3 days consecutive at minimum, or we also call it 2 midnights. So that's your first step. Then you have to have your doctor telling you that, hey, you need to go to the nursing home for some rehab. And you have to find a nursing home that is certified in Medicare. And you have to discharge to that nursing home, or you have to admit to that nursing home within 30 days of hospital discharge. So the most common thing that's going to happen is you're in the hospital, you're inpatient, you're there at least 3 days. Your doctor says, hey, Susan, you need to go for some rehab at the nursing home. And you say, okay, that sounds good. And they transport you to the nursing home. Now, something else could happen. Susan could tell that doctor, nope, I'm not going to the nursing home. I'm going home. Or the doctor doesn't think you need to go to the nursing home right then. And Susan goes home. But then it doesn't go as well as we all hoped, and you need to go to the nursing home. Well, if you can get admitted within 30 days of that 3 day at minimum inpatient stay, then you can still go to the nursing home. That one doesn't happen as often, but it is allowed. Now, your physician does have to certify that you need to go to the nursing home because you need daily skilled nursing or rehab care. You know, you need physical therapy, occupational therapy, speech therapy. Maybe you need IV medications or you need wound care. Now, what is short term? In the eyes of Medicare, short term is up to 100 days per benefit period. So your first 20 days are going to be fully covered by your Part A, meaning you have no copays or deductibles. So the first 20 days is covered at 100%. And then if you're still in the nursing home from days 21 to 100, you will have a copay of $217 per day. It usually goes up every year. And then at day 100, they're going to say to Susan, Susan, you're my guinea pig for nursing home placement. Susan, you're going to have to privately pay or go home. And you are going to have that conversation with nursing home staff, a social worker, your family, your support system, to determine if that is something that can happen. In most cases, it can. That is the goal of short-term rehab, for you to eventually go home. But there might be circumstances where that is not doable. So in a few slides, we're going to talk about options for needing to be at the nursing home longer. But if you were there for rehab, you reached day 100 in a benefit period, and you were not able to go home, that is usually switching you to long-term care. Now, you could still go home eventually, but at that moment, you are not able to. You will have to private pay for a while, and then the situation can be evaluated if you improve down the road. All right, so what are these covered services when you're in the nursing home for short-term rehab or IV care or wound treatment? Semi-private room and meals. Every nursing facility is different. I've had family in private rehab rooms, and I have had family in rooms where they have had a roommate. So it just depends on what they have available and what the nursing home offers. Nursing care provided by a registered nurse. Physical, occupational, and speech therapy. Medical social services, medications that they help manage for you, and necessary medical supplies. So what does Medicare not cover? Again, Medicare does not cover long-term care in a nursing home that is there to provide daily living activities or your activities of daily living. Bathing, dressing, eating, walking, transferring, managing your medications. Now they do manage your medications when you're there for the rehab, and they would for the long term as well. And then most nursing home residents generally require this type of ongoing care, which is why Medicare coverage is often limited to that short-term rehab piece. So let's go over some more costs. So this is your costs when you have original Medicare. So again, your first 20 days in a nursing home are zero. Days 21 to 100 are $217 a day in 2026. Now, if you have a secondary insurance, Medigap, through Medicare, that is going to cover your daily copay of $217. So that won't come out of your pocket. So as long as A pays first, your Medigap will pay second. Now, if you have Medicaid, that would also cover that $217. If you have other secondary insurance, that might also cover either all or some of that $217, but it's going to depend on what that secondary insurance is. Now, what if you have an Advantage plan? So still with your Advantage plan, at least for the Advantage plans I've seen, the first 20 days in a nursing home is still zero. Now, Advantage plans set their own deductible amounts, copay amounts, but generally, again, from what I've seen, they generally match the original Medicare copay for the nursing home. Susan, have you ever seen it, from your recollection, have seen it different than the Part A?
Yes, and
Okay.
this years ago, there were some shorter days, but I do have a question that was texted to me
Yeah.
that I think falls along these lines.
Okay.
Um, this is Angie, and she has an Advantage plan apparently. And she said that she didn't get the 20 days of coverage for her rehab stay. Angie,
Okay.
maybe you can give me a little more information, but
Mhm.
that's what I have right now. So under an Advantage plan, she didn't get the 20 days of
Free or at
coverage.
zero?
Mhm.
Okay, so let me back up then. Angie, I don't have a fantastic answer for you. So if you do have more details, let Susan know. But again, that's from what I've seen in my um times looking at Advantage plans. Generally, from what I've seen, it matches where the first 20 days is a $0 copay, but it again, Advantage plans can set their own allowable days, co-payments, and deductibles. So it's possible that you are on an Advantage plan that doesn't give you the full 20 days.
The other thing I was thinking about, it's possible that she did get sufficient rehab. The Advantage plan determined that she wasn't in need of 20 days because 20
Oh.
days, as we know, is not an automatic thing because it's medically necessary
Mhm.
dependent. Um, and the doctors determine, and the physical therapists or whatever therapy you're getting determine if you need more than 20 days or you
True.
need more than 2 days.
Mm-hmm.
So that might be the reason that she,
Yeah. Now I see where you're coming from, Susan. Maybe it's that the Advantage plan does usually cover 20 days at $0, but Angie didn't need those full 20 days. I see what, yep. Um, so Angie, give if there's any more info that you can give Susan, or if you would like to reach out to discuss this one-on-one, you can contact us at SHIP, and that phone number will be towards the end, or you can Facebook message us and Susan and I can chat with you. But yeah, just because um, your plan can give you 20 days or even 100 days, the full 100 days, doesn't mean with an Advantage plan that you will get all of that. And
or
we're,
under Medicare, really, right? I mean, it has to be medically necessary.
you're right, you're right. There is just a lot of different things out there with nursing home coverage with Medicare. From my knowledge, when you are on an Advantage plan, from our experience of working with Medicare clients, we do generally see or hear from nursing homes that Advantage plans do tend to give shorter days, not always, but we've seen it. And one of those reasons is Advantage plans do look at your situation in the nursing home closer. From what I've heard from multiple nursing homes and clients is the Advantage plan gets daily notes from nursing, rehab, and they're looking at your progress. And if you meet your goals or you plateau, they are going to want you to discharge at that point. We have heard from other Medicare beneficiaries, family members, nursing home staff, that sometimes residents do get notices that their Advantage plan is wanting to end their coverage because, again, they either think they've met their goals or they've plateaued. And there are times where family or the nursing home or the resident does not feel they are safe to leave, or they have truly not improved. On the other hand, we generally see, and keep in mind, everything I'm saying is not black and white 100%. These are just things that we've seen in this role working with Medicare beneficiaries or speaking to social work staff or admissions or office staff, nursing homes. When you're on original Medicare, that daily check-in with your insurance isn't there. Original Medicare Part A generally does not require daily notes. They don't look at the situation. Probably, well, I don't want to say they don't look at it as closely, but we do see there's a difference there from time to time. So just keep that in mind. But as Susan says, yes, it has to be medically necessary for you to have that coverage. And I have it probably on the next slide. You can appeal. If you get a Part A original Medicare denial or an Advantage plan denial, you can certainly appeal that at any point. Okay, there's nothing wrong with that. If you do not feel that you have met your goals or you're safe to go home, you can appeal and see what happens. All right, we went down a little rabbit hole there. So Advantage plans can set their own copay amount. I have normally seen it at the same as your original Medicare Part A copay, that $217. But again, Advantage plans can set their own copay amount. So there could be the potential that there is another copay amount out there. All right, we covered that last bullet point. Generally, Advantage plans do say they cover up to 100 days. But if they feel that it is that you have met your goals or you're plateaued, or maybe you can get rehab at home too, they will look at discharging you. But again, you can appeal any discharge notice. All right, so what to know a little bit more about Advantage plans. So Advantage plans can cover up to 100 days, and there are some that definitely do. However, like I've said, there could be the potential that they are going to look at discharging you before. You can appeal any denials. Now, this is something a lot of people don't know and is a very important piece to Medicare and admitting to a nursing home. So when you're on an Advantage plan, you get a special enrollment period, SEP, to change your Medicare plans. So if you admit to a nursing home, you live at a nursing home, or you discharge from a nursing home, you get a special enrollment, and you can do multiple things with that. You can move from your current Advantage plan to a different Advantage plan, or you can move from your Advantage plan, and this example is if you admit to a nursing home. So you can change from your current Advantage plan to back to original Medicare A and B. You'll get a drug plan. You could potentially look at getting a Medigap supplement to cover your out-of-pocket costs while on original Medicare. However, with Medigaps, they can look at your health history. And there's a special term called guaranteed issue. And if you qualify for guaranteed issue, then you can get a supplement, a Medigap, without them looking at your health history. But using the special enrollment to get off an Advantage plan to get on original Medicare does not give you a guaranteed issue phase. And if you're in the nursing home, that's telling us something medically is going on with you. And most likely, you would not be able to get a Medigap, or you would have to pay a higher premium. So just know if you go off your Advantage plan, back to original Medicare, you will have some out-of-pocket costs. So you'll just have to determine what's better for you at that time, but that is an option. And then if you discharge back home, you're gonna get that special enrollment again, and you could switch back to either your same Advantage plan or a different Advantage plan. So just keep that in mind. And then you do want to make sure that the nursing home you're admitting to is in network with your Advantage plan. If you're on original Medicare and you want to know if a provider takes your insurance, all you have to do is call them and say, hey, do you take Medicare? They're going to say yes or no. When you're on an Advantage plan, you can't just ask that. You need to ask, do you take United Healthcare PPO Choice Plan 1? So it's very specific. It's the same with nursing homes if you're on an Advantage plan, as it would be checking if your providers are in network. And if you're in the hospital, you're going to have a social worker or discharge planner assisting you with finding nursing homes and network that also have available beds. So they will help you do all of that legwork. All right, some key takeaways. But before I do that, Susan, do you have any other questions that have come in or any updates from Angie?
Not at this time.
Perfect. All right, so Medicare is short-term for nursing home, medically necessary skilled care, hospitalization, inpatient, 3 days minimum for IV treatment, wound care, or rehab, speech, occupational, or physical, or all of the above. Medicare does not cover long-term care in a nursing home. If possible, it's not always possible when you need a nursing home, but if possible, planning ahead can be helpful to manage costs, looking at Medicaid, private insurance, or personal funds. So if you are getting close to your day 100 and it's not looking like you'll be able to go home either at all or at least at that point, you do want to start having those conversations with the nursing home staff, the social worker, your support system on what your options are. Do you have long-term care insurance? Do you have private retiree insurance that might have some long-term care in it? Are you able to get on Medicaid? Do you have any savings that you could use to pay for long-term care or at least an extended stay past your Medicare approved days? Then you always want to check whether a nursing home is Medicare certified and confirm any coverage details before admission. So making sure that that nursing home is Medicare certified or takes your Advantage plan. Susan, anything else to add on this, or even just, your options for long-term care?
Nothing I can think of. I
Okay.
think you covered it very thoroughly. I think the question that a lot of people will have
Mhm.
is, so can you get this care in your home? And that is a different presentation that
Yes.
we have done. That's probably on our YouTube channel, but we'll
Mhm.
be doing that probably before the end of the year, I would
Mhm.
imagine.
Mhm.
So stay tuned for how Medicare covers in-home
Mhm.
services.
Yes. Yes.
Or
Uh,
you can always reach out to SHIP and we can send you some terrific
mhm.
materials developed by the Centers for Medicare and Medicaid about how Medicare covers in-home services.
Perfect. Thank you, Susan. That did remind me, I did want to touch on when it comes to needing to stay at the nursing home longer than that 100 days, either full long-term care or just an extended stay to give you some more care. We talked about the different ways that you can finance that, but where do you go to discuss that with someone at length more? Where are some resources? Now, you can always talk to the nursing home. So if you are looking at long-term placement, but you're not in a nursing home yet, you can tour different nursing homes in your area. And I would highly suggest to look at multiple nursing homes. You can either schedule a tour or you can even just show up. Now, they may not be able to give you a tour right then. Sometimes they can. But there's nothing to say that you can't do that. You can, if you're already in a nursing home, you kind of already know what the care is like, what the meals are like, the staff, all that stuff. Now, if you're already in a nursing home and you don't particularly want to stay longer at that nursing home, you always have the right to transfer to a different nursing home. So that is an option too. There are resources out there to find nursing homes or help you talk about the financial piece, care, all that stuff. The area agencies on aging, they would be a good starting point because they would have resources and you'd be able to talk to someone in their Aging and Disability Resource Center, most of the area agencies on aging. Again, you can reach out to nursing home staff to talk about things that are specific to their facilities. You could even reach out to something that we call ombudsman, OMBUDSMAN. And we are actually going to have an ombudsman at one of our future lunch and learns. I believe it's in August. Susan, does that sound kind of right to you?
It does.
Okay.
Late summer, August
Yes.
or September. Yeah.
You know what? We have that chart in a couple slides.
Very good.
So Susan will let us know very shortly. They are someone that goes into nursing homes or assisted livings, talks to residents, families, making sure that rules and regulations are being followed and that you are getting good care. So they might be someone to reach out to as well. They might have data on the nursing homes because nursing homes, if they are Medicare certified, they go through certifications and monitoring to see how they are doing to keep that funding. So there are resources out there for you. And if you have questions about where to go or how to find these resources, you can give us a call or a Facebook message and we will point you in the right direction.
That's such a good point, Megan, that you're making to try to plan ahead as much as you can. So I guess one example I would tell is, say you're going into the hospital for a major surgery, a hip replacement, something like that. And because of your personal situation, you don't have a lot of supports at home. So you're probably going to need your therapy delivered in the skilled care setting, a nursing facility. So this is the time before you have your surgery to check out some of the facilities that you think you might like. So when the discharge plan is occurring, you can tell your discharge planner or social worker this is where I want to go. Discharge planners and social workers routinely, every single day, multiple times of the day, discharge people to nursing facilities. But you want to be in control of that, and you want to be the one that chooses where you'll go. So if it's a pre-planned emergency, then heed Megan's terrific suggestion to plan ahead.
Thank you, Susan. That is a wonderful example. And you can always talk to your doctor beforehand too. Do you think this is going to be a situation where I need to go to the nursing home or not? But even if you ask that question and we all think, everyone thinks you can go home, sometimes things happen. And it's good to have that backup plan. All right, so if or when you have questions for us, you can call us at 1-800-452-4800. You can also Facebook message us or leave a comment here. Susan and I monitor those and we can reach out to you. You can visit us on our website, medicare.in.gov, and check out where our local SHIP sites are that you can connect with a SHIP counselor. Susan, would you like to let us know what's coming up?
That would be terrific. So continuing with our Lunch and Learn series, this is a new venture or adventure for Megan and me, and we do a Lunch and Learn show once a month, and we have tried to theme our Lunch and Learns. So this quarter's theme is Know Your Resources. So we have lined up some terrific resources. So coming up next on July 15th, I believe.
16th. It's a little
okay.
blurry. I apologize.
July 16th, we're going to talk about the roles of a community health worker and the roles of a healthcare navigator. Sometimes they're the same person and sometimes they're different. So find out how those people can help you. Then in August, our friend Kit Paternoster is a long-term care ombudsman in Central Indiana, and she will be joining us to talk about the role of the long-term care ombudsman and what services that you can receive from them. Then our last Know Your Resources show is going to be all about the Indiana Department of Insurance, which people might not even know that we have a Department of Insurance in Indiana, but we do, and they provide so many services to Hoosiers. So we're going to be joined by Jennifer Groff, and she's going to tell us all about what services Hoosiers can receive from the Indiana Department of Insurance. So you can flip a few pages forward and mark your calendar for those. But coming up the rest of the month, we have one more Facebook Live. Now, these are at 10 in the morning Eastern time. So I guess you're going to have a late breakfast with us instead of lunch. We have one coming up on June 29th, and that is Avoiding Common Pitfalls with Medicare. You know, we do talk to people every single day who say, if I only had known about SHIP before I made these decisions, I would be in a much better place. And there are other pitfalls besides not knowing about SHIP. So knowing is good. Find out your resources and get some information so you can avoid the common pitfalls that occur with many Medicare beneficiaries. So that is on June 29th. That's Monday morning at 10 a.m.
Susan, what do we have this evening?
Oh, excellent. Thank you.
You're
How could I
welcome.
forget? This evening at 6 Eastern time, 6 p.m. Eastern time, I guess you can join us for dinner. Megan and I are hosting a new to Medicare webinar. So this is not on Facebook. It is a true webinar, but it's live and you can ask us questions and it'll be just like us talking in person with hopefully many people. And we use Eventbrite to host those webinars. So if you just Google Indiana SHIP Eventbrite New to Medicare, it will pop up and there's still time to register. We don't limit how many people we have. We don't have huge numbers, but that kind of, makes it nice because then people have plenty of time to ask their questions and we all learn from each other. So if you want to know what Medicare is all about, or you want to share that with somebody, tonight, 6 p.m. Eastern Time, go to the Eventbrite website or just Google Eventbrite, new to Medicare, Indiana SHIP, and it will pop up and you can register. And then you will be sent the link to join us at 6 this evening. Thanks for reminding me about that. How could I forget?
I know. It's only in a few hours.
Yeah. Well, thank you so much for telling us about how Medicare does and does not cover skilled care in a nursing facility, Megan. And we hope to see many of you this evening.
Bye,
Have a good
everyone.
day.